Hello, everyone, and welcome to today's webinar entitled Embedding Equity in School Reopening, co-hosted by the University of Wisconsin-Madison's Division of Extension and Population Health Institute in partnership with the COVID-19 response team at the Wisconsin Department of Health Services. I'd like to take a brief moment to recognize the gravity of interconnected crises that our state and our country are currently facing. That being racism and violence that undermine the interconnectedness or the connectedness and cohesiveness of our communities, and for which COVID has shined a spotlight on the systemic inequities that put Black, Indigenous, and people of color at increased risk for experiencing disproportionate burden of COVID-19. There are very few easy decisions when it comes to planning for school reopening, and we know that school leaders want to do their best to reopen schools in a way that does not leave anyone behind. We'd like to take a brief moment to thank you for joining us today as we walk through tools and resources that you and your partners can use to center considerations of equity alongside infection control and prevention best practices throughout the development and implementation of return to school plans and informed plan adaptations throughout the year. I'm Amber Canto, the director of the Extension Institute for Health and Wellbeing at UW-Madison, and I'm joined today by my colleagues Paula Trananzeo and Christy Anderson from the Mobilizing Action Toward Community Health Group at the Population Health Institute. Together we staff and support the Community Resilience and Response Task Force, a task force of the state COVID response team. The objective of the Community Resilience and Response Task Force is to strengthen individual and community resilience of groups to disproportionate harm by the pandemic. Before we dig into today's content, I just want to review a few housekeeping items. All participants' mics are muted. If you have a comment or a question, if you have a question, use the Submit Questions Q&A feature. If you have a comment, you can use the chat box. If you have any technology needs, feel free to chat directly to Megan Wecker, and you can choose the accessibility of your participant chats when you chat them in. We will address questions at the end, but feel free to send any questions throughout the presentation. We will capture them and address them when we get through all of our content. The video will be posted for viewing following these presentations on the Extension's COVID response page, as well as on the Community Resilience and Response Task Force page at the UW Population Health Institute's website. Our outline today will start with welcome and introductions, then we'll dig into infection prevention and control and what we know about COVID-19 transmission in children. The meat of our conversation, though, will be working through tools and resources, best practices for embedding equity and engaging key stakeholders in rapid response in that second section of making decisions with equity in mind. And then, as previously noted, we will close with Q&A. Just to get a better sense of who we have with us today, we've got a quick poll with several different questions. In just a moment here, you'll see those poll questions flash up on your screen. The first question being, how would you describe the major components of your school or district's return to school plan? Virtual, physically distanced, in person, I'm not sure, or a plan has not yet been announced. We'll leave it open just a few moments longer for a couple additional votes. Great, so it looks like 43% of those of us who are joined today will be returning physically distanced, so a hybrid version. Great, our second poll question. To what extent do you feel a diverse group of stakeholders have been engaged in your school district's return to school planning? To great extent, somewhat, very little, or not at all. All right, on this one, we've got the majority responding somewhat. And for our final poll to kick us off, To what extent do you feel equity has been considered in the return to school planning process? To a great extent, somewhat, very little, or not at all. And as you respond to this poll, we'd invite you to elaborate a little bit on your response in the chat box. Please tell us in what ways you feel equity has been considered. What does that look like? What have been some of the considerations observed? And again, you can use the chat feature to give us a little more insight into your response. So just about 60% saying somewhat. Great, thank you all for your responses. I'm going to turn it over to Paula, who is going to walk us through some of the infection prevention and control considerations.
Thanks so much, Amber, and thanks again, everyone, for joining us this afternoon. So I'm going to give a very high-level overview on basics on COVID-19. As Amber mentioned, this is not going to be sort of the heart of our session, but did want to make sure that we started off everyone with the same base level of information. A quick recap that COVID-19 is spread through respiratory droplets that are released when an infected person coughs, sneezes, or breathes. And these droplets can remain in the air and on surfaces for an extended period of time. When people breathe in or inhale the droplets or touch surfaces that have been contaminated and then touch their mouth, face, or eyes, they can become infected. And we know that there are certain individuals and community members that are at more risk for severe illness. One of those reasons, or one of those factors, is if an individual has a pre-existing health condition such as high blood pressure, diabetes, heart disease, heart attack and stroke, chronic respiratory disease, and cancer. So there are particular members of our communities that we know that are more susceptible to getting sicker. Some prevention actions, and this aligns with what we know about this respiratory infection, is to wash your hands frequently with soap and water, to avoid touching your face with unwashed hands, to avoid close contact with individuals who are sick, to stay home if you're feeling sick or even if you're feeling off, to cover your sneeze and cough. You can cough in your elbows or use a Kleenex or tissue, and then you can wash your hands, to clean and disinfect high-touch surfaces, such as doorknobs and countertops, to practice physical distancing, so staying at least 6 feet away from folks and avoiding large gatherings, and wearing a cloth face covering when you're outside your home. Some symptoms of coronavirus disease is loss of taste or smell, fever, headache, fatigue, diarrhea, aching muscles, shortness of breath, phlegm buildup, or cough. And it's recommended currently that even if you're only experiencing one symptom, to get tested. So there's a lot that we still don't know about COVID-19. It is a novel virus, or a new virus, so the evidence continues to build every day. And this can sometimes feel confusing for folks. That I've heard members of partners that we engage with feel confused about information changing and not being able to keep up. And I sort of offer the example of the science around COVID is a lot like our technology and our computers, that every day the science and technology changes. So in order to make sure our computers are running efficiently, we have to update them and refresh them in order to make sure that they have everything they need to function to the best of its capacity. Similarly, we need to continue to update and refresh what we know about COVID-19 and what we're sharing. So in a read of the literature to date, we know that systemic inequities like structural racism have put Black, Indigenous, and people of color at increased risk of getting COVID-19 and experiencing severe illness or death. And we know that people of all ages with underlying medical conditions, as I just referenced, are considered at higher risk for those serious illnesses. Hospitalizations, ICU admissions, and deaths from COVID-19 are the lowest among those age 18 and younger so far. And children, but we do know that children under 10 can transmit COVID-19. However, based on what we know so far, they do appear to do so less frequently than older children and adults. And we know that as children of all ages are returning to school and engaging in other youth programs, that the role that they play in the spread of COVID-19 may change. So this is something we're definitely watching as schools around the country are opening and more youth programs are happening. Generally, children have less severe disease, and when infected with COVID-19, children are more likely to be asymptomatic or not show symptoms, or show fewer symptoms compared to adults to date. Again, this is something that is changing really rapidly, but over the past few months, because we've observed less severe disease in children, it could be true that children may have been less likely to be tested because they're not expressing as many symptoms, therefore potentially creating an artificially low case count. So this is also something that scientists are watching around the country. In addition, one of the tricky parts of this disease is that individuals that don't show symptoms or who are asymptomatic can still transmit the disease. And when we compare to seasonal flu, COVID-19 has up to 10 times the infection fatality rate in adults. Historically, we know a best practice around community flu transmission has shown that school closure can help reduce this transmission. So it's something that we're using to inform how we are sharing best practices related to schools for COVID-19. Again, more data is needed to continue to watch the impact on children specifically, and also the long-term health effects related to contracting COVID-19.
Thanks, Paula. Quick reminder that if folks do have questions about that portion of our presentation and/or things that come up along the way as we continue to move through the presentation, please continue to use the question and answer feature and the chat box to be engaging with the presenters. So we know that across return to school scenarios of all kinds, that there will be people more impacted than others who will need additional support. And the tools that we share today were intentionally created to encourage reflection on how any choices you're making about return to school may impact particular groups of people in your school communities more than others. These resources are designed to help local leaders navigate complex considerations and dynamic environments by asking important questions. And we just want to pause to note that there are no right answers in the context of this novel virus. We honor that we're all making the best decisions we can with the information that we have today. And it's also worth noting that as we continue to learn over the course of the coming weeks and months about what return to school really looks like in our communities, alongside this virus, it's very likely that schools will need to continue adapting their plans and policies as new information becomes available. So we hope that these tools are helpful and useful to your school communities today. We also hope they're useful into the future, so would encourage you to continue revisiting these resources throughout the school year. Quickly, just want to take a moment to ground us in one piece of shared language. We use the term equity a lot these days, and in this context, when we're talking about equity, we're really talking about ensuring that everyone has what they need. So this is different than the idea of equality, which tends to be focused on sort of sameness. So equality focuses on making sure that everyone gets the same resource or access to a resource in order to address a problem. And equality can work really well if everyone's starting from the same place. But if people are starting from different places, then giving everyone the same thing doesn't necessarily assure fair access to or ability to take advantage of the same kinds of opportunities. By contrast, equity seeks to address a problem or an inequity by customizing the level and types of resources available based on both needs and context. So equitable strategies might actually need to be unequal in order to ensure sufficiently similar opportunities for individuals and organizations to achieve their full potentials. So in the context of these tools, when we're using the term equity, that's sort of the definition that we're using applied in these contexts. I want to call your attention to a great resource that was developed by the Department of Public Instruction here in Wisconsin. They've pulled together sort of this list of questions that you'll see here regarding equity considerations for school leaders. And I won't read them all now, but I did include a link in these slides that we'll share after this presentation, as well as in the resource packet that we'll share. And you might see it come through the chat as well here momentarily. Just wanted to raise this up. This is a great resource and sort of a great grounding for school leaders. And we actually hope that some of the tools that we're planning to share today will help you address some of these considerations in your school communities. Paul, I'll turn it back over to you to talk a little bit about data.
Thanks, Christy. So one of the questions that we've been commonly getting is how do we use data to inform our equitable decision making? And we want to just offer this as one way to consider how you might use the information that's out in the world to help think about equity and decision making. So here are 4 buckets, if you will, that can include both quantitative information and qualitative information. So one big bucket is around disease activity, and this information can be found at the Department of Health Services website, where they are showing and displaying county level data on the nature of disease in a particular community, as well as a whole host of other information. But one thing to consider is, what does disease activity look like in my local community? Another piece of information around disease activity is, what are the other things that are happening in my community that might impact disease activity? So might either increase potential disease spread or decrease it. And that's a bit more qualitative. And this can include things like if businesses and restaurants are open, if there's a lot of face covering usage in a community, if other activities such as athletics and other extracurricular activities are also happening. All of these opportunities for congregating and gathering can increase the amount of disease activity in a community or increase the risk of disease activity. Another large bucket is around community context. And 2 questions we offer there is, who in the community is at the most risk for COVID-19? So as you consider in your local community, where is there already underlying disease, health issues? And you can find that information often in your local community health needs assessment. And also another way to understand risk, which might be a little bit more qualitative, is what's the nature of the workforce in our community. If our community has a lot of types of jobs and businesses that require people to be in congregate settings, to be close together, like in food processing plants, that's one space where it's tricky to implement best practices. There are certainly best practices for those places, but that's another more qualitative way to understand community context that might relate then to disease activity or those that might be a higher risk. Another question there is, who in the community has already been experiencing inequities? And this information can be found, actually schools are a really great resource for data on who's already experiencing inequity. One example indicator might be free and reduced lunch usage to understand the nature of where families are in communities. Another bucket of considerations is infection control and outbreak response capacity. So to what extent do local schools have the ability and resources to follow infection control best practices that have been put forth by the Department of Health Services and the Department of Public Instruction? We know that some of the suggestions require additional resources that schools may or may not have, and we know that there are dollars available, additional dollars available to do this, but that's one key consideration is how well can schools abide by the best practices? Another consideration to gather data around is, to what extent does your local public health and health system capacities have the resources and ability to manage outbreaks and healthcare related needs? And this information can be found on the Department of Health Services website, and many local health departments are also posting these data on their website as well. And this includes capacity to contact trace, capacity to test, capacity to support safe and effective isolation and quarantine, as well as what's our hospital system capacity to manage hospital-related needs for COVID. And then the last bucket we might offer as a suggestion to understand both quantitative and qualitative data around social, emotional, educational, and economic support capacity. So again, any decision we make, there will be trade-offs. So to what extent does our local community have the ability and resources to mitigate the challenges? For example, we know that one of the big challenges related to quarantine and isolation is that folks might not have the ability to stay home from work and still have the funds to feed their families. So what economic supports might we be able to provide to mitigate that harm? Another example is around emotional supports, right? For specific young people that require going to schools for specific programming and services. And these buckets you'll see will show up as Christy walks through some of the tools we'll be sharing today. But this is an example way to hold different kinds of quantitative and qualitative information as you're making decisions.
Thanks, Paula. For folks who aren't monitoring the chat, I'll just point out a request for the PowerPoints to be shared. Really glad that this graphic is useful to you. And yes, absolutely, we will make sure to share and hope that you continue to use this in your own work. So glad to hear it's useful. So the first resource we'll walk through today is called Community Resilience, Equity, and Mental Health Considerations in Rapid Response. And this resource is really broken down into 3 sections. So the first section of this tool invites you to sort of reflect on your purpose. What is the policy guidance or action that you're focused on? And what is the goal of that policy guidance or action that you're looking to implement? The next section of this tool invites space for you to sort of analyze and walks you through, based on that action, guidance, or policy that you've identified, a series of questions with equity in mind. So to ask you to consider who is most likely to benefit from the action that you're focused on, who might be negatively or differently impacted, and what are some of the potential unintended consequences you may not yet have considered as you're sort of thinking about the implementation for this particular action. And then finally, based on that analysis, this tool will encourage you to consider some recommendations to adapt your action, guidance, or policy based on those recommendations that are designed to minimize harm identified through your analysis. And this sort of really high-level overview might feel a bit nebulous. So we'll walk you through an example. We've built out a number of examples in the slide deck and in the resource packet that we plan to share, but for time's sake, we'll walk through one today just to sort of ground you in what this looks like in application. So the example that we'll consider together today is the need to ensure that all attendance policies for a school district or building are adapted to align with our return to school plans. And we know that a one-size-fits-all approach rarely benefits all folks in the same way. So in this example, we'll try to focus on raising up some of the needs of students who are most likely to have to shoulder the heaviest burden of disproportionate harm, and those who are most impacted by a decision like this. In this example, the context that we're operating within is that we know return to school planning will require updates to our school attendance policies aligned to the unique plan formats that we're implementing in our local communities, be them in-person, hybrid models, or virtual return to school models. And that these policy updates will likely include expectations around enforcement and absence-related discipline practices. So the question in front of us is, how do we consider attendance policies are adapted to align to our return to school plans? And the action in front of us is pretty simple, right? An update to school attendance and enforcement policies. Pretty straightforward request. So as we move into the analysis section of this tool, we can ask some questions with equity in mind. So that first question, who might be impacted differently by this action? I'll raise up 2 examples, but there are certainly more related to this particular policy. Students of color, in particular young men of color, students with disabilities, and students with histories of school discipline challenges, often disproportionately, young people of color, in particular young men of color, students with disabilities, and students with unique learning needs. We know that we have a long history of discriminatory enforcement of school discipline policies for these particular populations of students, which includes absentee policies due to implicit bias embedded in our public education systems and in our communities. Another group that might be differently impacted by action related to updates to absentee policies or practices include students whose parents or primary caregivers do not work in roles with flexible scheduling or paid time off, and who are therefore being called to step into caregiving roles or additional support roles in their homes for younger siblings and for additional family members. Another question this tool will invite us to ask is, how might these groups of students be differently impacted? What does that really look like? And for attendance policies rooted in punitive enforcement practices in particular, as I just mentioned, we have documented data that tells us that these policies are often inequitably enforced due to implicit bias and widespread discretion in application. And these are unprecedented times, and families are dealing with complex realities. So while the choice to come to school or to sign on to a virtual classroom might seem simple for some students, it's much more difficult for other students, especially those who are taking on additional at-home or family responsibilities, such as caring for younger siblings and family members. And finally, this tool will invite us to consider, what are the potential unintended consequences of the action that we're considering? So we know that enforcement policies that rely on suspension or detention, or those sort of punitive enforcement practices, might unfortunately further limit students' in-class time, risking setting them even farther behind in their academics. Punitive enforcement practices are often tied to student records and have long-term impacts on their academic careers and long-term academic success. And finally, punitive enforcement policies might actually deter students from reporting symptoms and staying home when they're feeling unwell or have a known exposure to COVID-19. The last section of this tool is focused on recommendations. So it'll ask us, how can we mitigate or minimize any negative unintended consequences that we've identified related to the action of focus? So in this case, again, that implementation of those new school absence policies. So in this context, first, we might anticipate and sort of honor that these are unprecedented times that absolutely will impact student attendance across all grade levels, and just sort of acknowledge that. Next, in our recommendations, we can work to ensure that enforcement recommendations around attendance policies avoid penalty assignments for noncompliance. We can avoid policies that further limit students' in-class time, such as suspensions and detentions. And we can work to ensure that any new policy has an explicit plan in place to connect students experiencing increases in absenteeism to additional community and school resources and support, making sure that we see that as an indicator of a need for support rather than an indicator of a need for an assignment of a punitive discipline practice. So as I shared, we've applied this resource across a wide range of considerations that we've heard across a pretty diverse group of stakeholders and compiled them into a best practice resource that we'll include in the chat momentarily. But this is really a living document, and it's meant to be responsive and adaptive to current needs. So we'll include our contact information in the follow-up note to this webinar, but just really would invite folks, if there are ways that these resources could be more useful to you and your school community, we welcome that feedback. This best practice list, I know the text is small, so I'll just call it a few, speaks to sort of considerations around cohorting, curriculum limitations, symptom reporting, staggered timelines, support for undocumented students and staff, and virtual learning considerations. So all things that are sort of highlighted in this resource and that we tried to take the tool we just walked through and apply to some of the considerations we've heard are particularly relevant across the state right now. The next resource we'll look at is focused specifically on stakeholder engagement in rapid response. So we know that we get more done and have greater impact when we work with diverse groups. And we know that no matter what we do, there will always be folks who support our approach and folks who wish we'd taken a different one. And in times like these, we have to be really intentional about our engagement, both because we have limited time and resources, but also because we're operating in really rapidly changing environments where quick decisions are made on a regular basis. And the earlier we can engage folks on an issue, the earlier we'll know who supports us, who's got differing opinions, and how we can work together toward a path forward. So this resource is actually meant to be used in partnership and alongside the resource that we just walked through. So when you're using this tool, there are 3 key groups that we hope folks will focus on when they're thinking about stakeholder engagement, in particular, again, in this sort of rapid response space. So first, folks who are most impacted by the particular action, guidance, or policy that you're working to implement or make decisions around. And this is always our recommendation. it's always our recommendation to start your sort of plan around engagement by considering this group first. Another group you'll want to consider is your trusted messengers. Who are those who have your back and support your action? And the last group is sort of this idea of influential messengers who are most likely opposed to your effort. And when we're talking about stakeholders in this space, we're using that term pretty broadly. So stakeholders can be individuals, networks of individuals, organizations, anyone who's affected by or has an interest in, influence over, or responsibility for the action, policy, or guidance you're addressing. And stakeholders can represent formal networks, so those who represent major institutions in your community, such as government leaders, education representatives, health system folks, and business leaders, as well as informal networks, so those most closely connected to residents themselves, such as neighborhood associations, PTOs, and church groups. And as you're thinking about your sort of trusted supporters and those who are influential but in opposition, you also want to consider, okay, these folks may or may not be on my side, but I really need to think about who has the power to either help me implement or maybe block the action, policy, or guidance that I'm proposing. You'll want to make sure that those people are involved in your outreach and are represented in this sort of worksheet that you're working through. And if you can't reach the folks in those sort of positions of power directly, you might want to think about who influences those people or organizations with that power. Who do they listen to, and how might you reach those key messengers as a strategy to get your sort of message across? Quick snapshot here of the next page of this resource. This resource, again, just sort of walks you through those 3 stakeholder groups and invites you to identify your key stakeholders related to the action, guidance, or policy you're looking to implement. And then the next page of the tool is a page to make a plan. So this tool is, again, pretty simple to use. Once you identify your 3 stakeholders, this resource just invites you to sketch out a plan for how you'll reach these folks. All of the documents included in this packet are fillable PDFs, so hopefully you'll be able to download them, type into them pretty easily, and use them in really dynamic ways. The last page of this resource is just a listing of some general principles for engagement and rapid response. And again, we hope that this sort of list of principles sort of lowers any anxieties that you might have around stakeholder engagement and encourages you to be honest and authentic, to be really clear about what you're asking for from the stakeholders you're engaging, to not assume that you have to do this work alone, to be gentle with yourself and to be patient with those that you're trying to reach, to be open to learning and to remember that it's okay that you don't have all the answers because no one does at this moment in time, and a number of others, but just sort of a pause and reflection on, you know, the idea of doing this exactly right or doing this exactly perfect is not the goal. The goal is sort of the intention behind how are we engaging folks who are most impacted, our influential supporters, and our influential opposition so that we can do this work together. So all the tools that we discussed today, we've packaged together in a resource list that you see here. And again, we'll make sure to share this with the group. This package includes all the resources we walked through today, as well as a sort of key resource list related to infection prevention and control, school-specific resources, COVID-19 in children, resources, and then some additional equity resources. It's also worth pointing out, again, that while we hope these resources are helpful today, we're operating in dynamic times, so we hope they'll continue to be useful over time as you continue to sort of learn and adapt your approaches throughout the school year. We also hope that these resources might be applicable to partners in your communities, so please feel free to share them beyond your school community with anyone who is sort of helping to support students, staff, and families throughout this pandemic. I'll highlight just a couple of the resources that are linked from our partners. So the Wisconsin Department of Public Instruction, my guess is that many of you are deeply familiar with the guidance coming out of the Department of Public Instruction, but Education Forward is linked here. This is sort of the core guidance document and resource from DPI heading into the school year, as well as a checklist around reopening school buildings, a risk assessment tool that's incredibly helpful. Want to make sure to call attention to that. Some resources from the Department of Health Services, again, a wealth of resources on their website, just calling attention to a fairly new decision tool for individuals and families that's up on the website, a really useful tool, as well as guidelines for prevention, investigation, and control of COVID-19 outbreaks in K-12. schools in Wisconsin. So this is a complement to the DPI guidance, but want to make sure that folks have that on their radar. A link here to the Wisconsin Department of Safety and Professional Services, so DSPS, again, a wealth of resources here in particular around infection prevention and control and safety for school leaders and staff. And then finally, again, we promised a whole host of resources in this packet, so we'll just call attention to a few. 2 modules, video modules, one from the University of Wisconsin Division of Extension around risks and guidance related to COVID-19, and one from Johns Hopkins. These are good sort of complementary resources for folks who are looking for either a really high-level brief overview of the virus or a more detailed but still sort of overview. What is this virus? What does it look like? And what do I need to know? Also good for sharing with partners. And then a resource from the Minnesota Public Schools and a resource from the Harvard Global Health Institute. So again, these will all be linked in the packet, but wanted to call particular attention to these resources.
Thank you so much, Paula and Christy. And we have reached the portion of our presentation where we will now turn to your questions. And to support us in taking your questions, we have a few additional Community Resilience and Response Task Force members with us, as well as additional subject matter and technical experts. So we have Beth Ellinger from the Wisconsin Department of Health Services, as well as Dr. Sabrina Murphy, who is a UW Prevention Medicine resident. So while we wait for your questions to come in, I've got a few that I have queued up based off of the questions you submitted at the time of registration. So the first question that I'll kick over to you, Christy and Paula, is what are some of the major school equity considerations that school partners should be aware of?
Definitely. Thanks, Amber. I think, we sort of collected a whole laundry list of considerations in that best practice resource. But if we had to call out sort of 3 buckets of core considerations or sort of core themes that we hear across all of those considerations, we're hearing a lot about broadband access and challenges in all of our counties related to access to the internet and really what that means for students and families who are trying to log in or participate in their school communities from a virtual platform, or even folks in a hybrid platform or an in-person platform. We know that internet is such a crucial resource in these moments, and we know that many families still don't have reliable access to broadband services in our state. So that's one thing that we're absolutely hearing. We're hearing a lot of concern around disruption of student services and support. And I think that includes both sort of the formal services that might be contracted for students, so PT, OT, speech, those kinds of things, but also the informal services. We know that the school environment is about much more than sort of the core academic curriculum that's delivered in the classroom. It is a space where many kids come for nutrition and for meal security. We know it's a place where lots of kids come to feel safe, to feel heard, to feel supported by adults and sort of trusted folks in the school community. We know that school is a place where kids come for peer support and socialization and enrichment and all of the things that happen inside a school building and inside those classrooms. And so this idea of no matter what our plan is today, having contingency plans, knowing that it's likely we are going to continue learning and adapting to meet the needs of our school staff, of our students and our families, and making sure that those contingency plans pay particular attention to the delivery of both those formal services and those informal services and supports that students rely on our school buildings for. And I think that we're hearing a lot from folks that those sort of contingency plans and that attention to making sure that those disruptions are as minimal as possible don't only happen with school partners, they also happen with community partners and sort of trusted networks of support outside the school building. So it's just encouragement to think about what that mitigation for disruption looks like with your partners across communities. Then I think we're hearing a lot about just sort of the need for communication and trust, and making sure that in these times when fear and anxiety and tension and sort of everything in the sort of world feels really heavy for these families, to be patient with folks and to establish reliable and predictable lines of communication that folks can really trust will exist and can trust they can go to for reliable information. And I think that, knowing that we can leverage communication and sort of be reiterating communication that we're hearing in many different venues, because we're all trying to download a lot of new information. So just making that those lines of communication as simple and straightforward as possible is really important.
And one thing I'll add is, as we've mentioned throughout our session today, the equity issues that exist right now are exacerbated issues that existed before COVID-19. So I really just want to underscore what Christy was talking about in terms of talking to people most impacted. Teachers are those on the front lines that watch these inequities every day. So listening to teachers, listening to families, and hearing their direct experiences in order to understand the way equity considerations manifest at the local level are really important. So just want to underscore that kind of engagement and the trust of people that interact with these issues day in and day out.
Great, thank you. And our next question, in what ways can nonprofits and other youth-serving agencies apply these equity considerations to their decision-making? And maybe Christy, you want to take that one?
Yeah, I think it's a great question. I think there are lots of ways, and this will look different across all communities. But I think first and foremost, again, you will hear us sort of say this again and again, youth-serving organizations and nonprofits and communities have sort of often sit in these unique roles where they hold trusted relationships and sort of existing relationships with students and families. And so I think taking that role really seriously and doing what you can to amplify the real needs that you might hear differently than folks in a school community or folks in a healthcare setting or folks in a different environment, hearing those things and really using your sort of role to amplify those needs to folks who are in positions to make decisions about what this sort of return to school looks like. So I think that's one thing, is just to really be mindful of those relationships and to do what you can to amplify those needs that you're hearing in a trusted and safe way. I also think that a lot of nonprofit organizations are also evaluating their policies and their programs. So please feel free to share this resource with them. But also, if you are a youth-serving organization or a nonprofit, thinking about how you're evaluating those policies and practices to adapt and be responsive to the needs that you're hearing from students, families, your school communities, your local public health partners, and sort of building those new policies and new programs to be adaptive over time. We know that we're operating in a really dynamic environment, so making sure that we're building systems that are dynamic and responsive, I think is really important. I also think, again, to the sort of communication and open trust, establishing and sort of contributing to the establishment of really clear lines of communication that are amplifying consistent information and amplifying the information that your school leaders and your local public health officials need to be heard by families. Really helpful way for you to sort of use your trusted networks. A lot of nonprofits have access to real sort of tangible resources. So you might have a building, you might have staff support, you might have funds, you might have all kinds of resources at your disposal, and thinking about how you can align those resources to needs in the community. So that might be, opening some of the free space you have in your building to a group of students that needs a quiet place to sort of be safe and to do their work. Those kinds of things, being really creative and nimble with your resources. And then finally, I would just, again, sort of encourage you to be in constant communication and sort of proactively looking for ways that you can sort of amplify and support what your local school communities and your local public health officials are asking of the community. We know that there's a lot of noise out there, and there are lots of folks who, again, are operating in these environments of fear and anxiety. And so doing what you can as a trusted messenger to really help people understand why it's important to wear face masks, why it's important to practice social distancing practices, why it's important to sort of practice these general public health guidelines, because it's in the best interest of the people that we love.
Thanks so much, Christy. And we received a question asking for any resources that we could share with teachers to provide ideas on leading discussions on current events regarding race relations. Is there a panelist that would like to address that one?
Yeah, I can jump in, Amber. So I will encourage folks to really look at the Department of Public Instruction website, landing a link in the chat box right now. They have resources for talking to students about race, and they were just refreshed early this year, including media, PBS videos and links, books for young kids around anti-racism. So that's a great place to start, and there's several links on their website that can take you to down many rabbit holes for more resources and information as well.
Great, thanks, Paula. And we did acknowledge that infection prevention and control was not a major focus of today's webinar, but we have received a couple of questions related to infection prevention strategies that schools are considering. So maybe Beth and Sabrina, if you'd like to jump in, what are some of the major infection prevention strategies that schools are considering? Is there any guidance available that to help inform their outbreak planning and support?
Sure, I can start. So the basics of infection prevention, not just with COVID, but with other diseases as well, is number one way to prevent infectious disease is hand hygiene. So really focusing on hand hygiene, teaching kids in the classroom or virtually as well, whatever the setup is. Those reminders are good at school, they're good when they're in public, they're good at home. So that's one basic step that is helpful for schools. And of course, you can get this information on the DHS webpage. There's information through DPI and great pictures and visuals through CDC as well. Another thing, for kids, we expect adults to do it. Sometimes they don't do it very well, but we really want to also teach kids, respiratory hygiene, covering your cough, Kleenexes, trying to cough in the crook of your arm versus your hand and then touching things. So those are important messages for school kids as well. Those types of reminders, again, it's not just for school, but when they're out in public and at home as well. That's something that's very helpful as well. And then more geared towards the schools themselves and the facilities is really environmental cleaning, following the correct directions for that particular cleaner, having enhanced cleaning. I think a lot of schools that are doing a phased or, in school, they're taking extra time, they've made extra plans to do cleaning. So those are in, DPI information. There's also information on DHS and the CC website about just environmental cleaning. And that's important. Kids are going to be touching things in classrooms. It's important to clean in between uses of items as well. So those are some basic things that, not just prevent COVID, but prevent all infectious diseases. And that's something that, those lessons they can take with them as they're going through school.
Yeah, I those are great recommendations. And I think that's kind of like the cornerstone of what we want whenever we talk about infection prevention. Some of the other things that we always like to try to mention when we talk about people coming back to work or coming back to school or coming back to a facility is to really just try to make sure that within the facility or within the policy that there is an emphasis or a discussion about having people, so when we talk about students as well as teachers, to stay home when it's appropriate, and to try to make that more of a priority, especially if they're having signs or symptoms. The other one is to encourage cloth face covering, especially when it's difficult to social distance, when appropriate, for appropriate ages. And the other more specific to schools is there is a talk about trying to identify small groups or cohorts or have similar people stay together throughout the day and try not to have too much mixing of students, as well as considering alternate schedules to really help prevent the spread. And the other thing that I always like to talk to people about, if I can get to them early enough, is to really think about what your plan is going to be. Not really if, but probably when there is an outbreak, or when somebody shows up, even if it's symptoms that are similar to COVID. They might not have COVID, but it might be the flu, but still you want to have those kind of planned in place. There's a contact person who's going to, who's going to kind of go through what the plan is, as well as identifying where you can isolate appropriately, as well as kind of all of those systems are already in place prior to any type of possible case or suspected case that shows up. So I think that's really important. The more you can get that system in place, the better off the whole facility and the people involved are going to be.
Great, thank you both. And somewhat of a related question, we know many parents are concerned with assuring kids have access to physical activities or other extracurriculars, and questions have been raised around how do we balance the access or engagement to extracurricular activities with infection control as we think about this return to school in the fall?
So that's a good question. If we're sharing equipment, things like that, making sure we're disinfecting those things. Obviously the small groups, activities, trying to social distance as much as possible while we're doing small groups. So as weather permits, allowing outside activities. Just in general, where I live, my daughter's dance school is offering some virtual online dance classes. So, she can still get some activity that way. There may be options to explore through your community. There's a lot of community organizations that have things for kids that are usually in person, but now, they can do some online things. So they can do it from their home, but still be active and moving, which is, really important. We don't want to forget about the other important health aspects of school and activity. So those are things that you can do. I mean, just taking walks as families, things like that, where you know that you're with your group, that you're not worried about exposures and things like that. So, I'm not an education expert, so I can't speak to all the things in school, but those are some other ideas that folks in the community can use so that, they're not feeling like their child is missing out on really important activity time.
Thanks so much, Beth. And I think that particular question, I think, highlights the number of trade-offs we have to consider as community leaders, and that the more we do in our communities that increase potential for spread, the more that will make it difficult to contain the disease and allow us to go back to a stage of life where we, a pre-COVID sort of mixing and gathering space. So want to just lift up, and that sort of speaks to one of the quadrants in that decision-making slide of, how do we hold these decisions that we're making in a school context in a community context, so that we can have broader conversations about what we as a community are going to do to prioritize, getting kids back to school, an essential function, alongside of many other trade-offs that we know are really difficult decisions to make for community leaders right now.
Thank you all for those responses. We've also received several questions regarding supports for students with special needs, ideas or resources that we can highlight to assist partners in supporting schools around this concern.
Yeah, I'm happy to share a few. I think generally what we know about students with special healthcare needs or complex care needs or non-health related sort of special academic needs, every sort of student's situation is going to be unique. And so I think that sort of echoing what you've heard from us, the sooner that you can engage with those students themselves, their family members, their healthcare providers, and sort of the staff either in the school who already know them best, or staff in the school who are most likely to be sort of closest connected to their support and care, the better. As those policies are enacted, you're making the needed considerations for the unique needs of each particular student. I know that sometimes that might feel like a lot, and the more proactive we can be about sort of making sure that each of these policies that we're sort of adapting and changing meets the unique needs of that student early on, the less likely we will see sort of disproportionate harm and sort of undue burden on students that already have sort of complex realities that they're navigating. I also, so I'll point to a DPI resource that has just sort of some good information about sort of the core protocols in particular around students with unique healthcare needs. And then we'll also point to a resource from Children's Hospital that's great. It has got some great sort of list of questions around engaging with healthcare providers in particular. But the other sort of thing I would note is a lot of these students actually already have individual education plans and IEPs. And so for students who already have IEPs, making sure that whatever the considerations we're thinking about sort of broadly track to those existing IEPs, and that those IEPs are updated. We also know that the schedule for updating IEPs might not necessarily fall alongside the same sort of schedule for the broader policies that are being updated. So just making sure that those documents and sort of communications for families, for staff, and for students are all sort of coordinated and talking to each other. I think honoring that everything will be sort of unique and different, but making time and space for those things is our sort of best recommendation.
Thanks so much, Christy. We have exhausted all of the questions that we have received from you ahead of today's webinar, as well as during our time together. So I'll take a brief moment to nudge for any final questions in the minutes that we have left today. And while I encourage you all to stick that into the chat box, I am going to launch one final poll as a part of our federal reporting requirements. We do ask all participants in our education events to complete some demographic information. And this is entirely voluntary. If you choose not to respond, feel free to select the prefer not to respond option. And again, your responses will be anonymous and again is used for our information and federal reporting purposes. So thank you so much for taking a moment to complete that poll. And while you complete the poll, again, I'm just monitoring the Q&A feature here for any additional questions that may come in before we round out our presentation today. All right, not seeing anything coming in, I will move us to close out today's presentation. Thank you again to all of our presenters who joined, to all of our participants for coming and joining in the conversation. We do hope that these tools and resources will be useful to you. And as we've mentioned, we look forward to your feedback on how the tools are being applied, additional resources that you may have knowledge or awareness of. Please share those with us. We know that information is evolving every day as we address this novel virus, and as such, there's a lot emerging all the time. So with that, thank you, and we look forward to your feedback. We hope you have a great rest of the day.